Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 213. Ischemia, susceptible areas. Why is it important to understand that some areas in the body are susceptible to hypoxia? The reason this is important to know is because there are certain areas of the body that receives distal blood supply, which means that it's already poor in oxygen. So because these areas are already in normal situation receiving oxygen poor blood supply, any further decrease in blood supply will therefore lead to some sort of problems. Name the areas in the brain susceptible to hypoxia and ischemia or infarction. The areas in the brain susceptible to hypoxia includes the ACA, which is the anterior cerebral artery, MCA, which is the middle cerebral artery, and PCA, which is the posterior cerebral artery. Name the area of the heart susceptible to hypoxia and ischemia or infarction. The area of the heart susceptible to hypoxia is the subendocardium of the left ventricle. What area of the kidney is susceptible to hypoxia and ischemia or infarction? The areas of the kidney susceptible to hypoxia is the straight segment of the proximal tubule in the medulla, as well as the thick ascending limb in the medulla. What area of the liver is susceptible to hypoxia and ischemia or infarction? The area of the liver susceptible to hypoxia is the area around the central vein, which is the zone 3. What area in the colon is susceptible to hypoxia and ischemia or infarction? The area in the colon that is susceptible to hypoxia is the splenic flexure and the rectum. What is the watershed area? Watershed area is any area that receives dual blood supply from most distal branches of two arteries. So in this situation, just because of that dual blood supply, there is adequate amount of oxygen going to this area. So if one of those things were to be blocked up, it would receive in hypoxia, and that's why these areas, the ones that receive dual blood supply, are one of those areas susceptible to hypoxia. Name the cells that are most commonly affected in hypoxic ischemic encephalopathy or HIE. In HIE, the cells that are primarily affected are the pyramidal cells of the hippocampus and Purkinje cells.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.